Let's go ahead and get started. I'm Joseph Sapien. Welcome, everyone. I'm Joseph Sapien, Program Director for HealthInno. We have a lot to cover today, so let's get started. I want to thank take a quick moment to introduce and thank Digital Health Hub Foundation behind today's session and the annual Digital Health Hub Awards. Please welcome Mark Goldstein, founder and executive producer for Digital Health and AI Awards. Welcome, Mark.
Thanks, Joe. Look, it's great to be here. We've been working with uh, the HealthInno group for 2 or 3 years. We're super fans of everything that's going on in New Mexico. We then spend time in Las Vegas at the HLTH show with them. Um, Lots going on in obviously in digital health and AI this year, and some of the innovation that's coming out of not only New Mexico, but this group is particularly exciting about to us. So. I'm here to just open this up, introduce what is going to be a great session and format, and hopefully I'll be able to see all of you or a number of you in Las Vegas in November. And with that, Joe, I'm going to roll right back to you.
All right. Thank you, Mark. I appreciate all the work and support that you all have done. So yeah, let's jump into it. I want to introduce our next speaker. Um, she wears many hats. She's the founder of HealthInno, which is New Mexico's Center for Health Tech Innovation, and also the director for strategic partnerships at Builders VC. Builders are a team of lean operators and investors backing founders who tackle the messy, mission-critical problems that reshape the systems we rely on. So, a true leader for meaningful work in the state and beyond. Please welcome my good friend, Angelica Maestas.
Hi, folks. I'm excited to be here today. As Joseph mentioned, I wear a couple of hats that intersect really nicely for this conversation. I'm the founder of HealthInno, where we're leading our state's health-wide innovation infrastructure. And I also lead strategic partnerships for Builders VC, a Bay Area-based venture fund backing founders transforming critical industries. Together, those roles give me a unique perspective on what early stage companies need to successfully move from promising tech to real world deployment. I want to start by challenging something I think a lot of digital health founders assume. When people think about scaling a health tech company, they often think they need to start on the East or West coasts. I'd actually argue that's backwards. The hardest healthcare problems, and often the most valuable ones to solve, exist in places that have historically been overlooked. New Mexico companies New Mexico gives companies the opportunity to prove that their solution works where healthcare delivery is genuinely difficult. We're talking about rural communities, tribal communities, large Medicaid populations, provider shortages, long travel distances, and limited specialty access. And so if your technology creates meaningful value here, there's a very good chance it'll create value almost anywhere. And that doesn't make New Mexico a small market. It makes it an incredibly high signal proving ground. Next slide. And we already have the ingredients to make that happen. We have strong healthcare leadership across the state, outstanding research and data science expertise at our national labs and universities, entrepreneurs building innovative healthcare solutions, state leadership that's investing in innovation infrastructure, and perhaps most importantly, we have real healthcare challenges that need solving. And so we're not reacting to innovation happening elsewhere. We have the opportunity to help shape what gets tested, what gets learned, and ultimately what scales. So naturally, the next question becomes, how do we actually make that happen? How do we move from great technology to successful implementation? Before I explain this framework, let me give a little context. As Builders VC expanded into New Mexico, we saw something pretty unique. There were already incredible healthcare orgs, researchers, entrepreneurs, investors, and policymakers doing important work, but there wasn't a coordinated infrastructure connecting everyone around healthcare innovation. And so rather than simply investing in companies here, Builders wanted to help strengthen the innovation ecosystem itself, and that's why we partnered with HealthInno. The goal wasn't just to create more pilots, it was to create an ecosystem where innovation could consistently succeed. This slide really captures how we think about innovation. It's much more than matchmaking. It's about building the relationships and infrastructure that allow good ideas to become real healthcare solutions. At the top are our community partners. They help ensure that innovation stays grounded in the needs of the people we're actually trying to serve. Because technology shouldn't happen to communities, it should happen with them. Our healthcare orgs help define priorities and lead pilots. But the best pilots aren't companies trying to convince health systems to buy something. They're partnerships where both sides are solving a shared problem together. Academia, our universities help design evaluations and generate evidence. And that's incredibly important because successful implementation isn't just about adoption, it's about demonstrating measurable outcomes. Investors play a different but equally important role. From an investor's perspective, the best companies don't just have impressive tech, they know how to navigate complex healthcare environments, generate meaningful evidence, and build repeatable commercial traction. And our policymakers and economic development partners help reduce friction, whether that's funding infrastructure, supporting collaboration, or creating an environment where innovation can move faster. And HealthInno sits right in the middle of all of those relationships. Our job isn't simply to make introductions, it's to help companies engage the right partners in the right sequence at the right time. So, what does that actually look like for a company? Many founders come to us thinking they're looking for customers, and that's understandable, but that shouldn't be the only thing they're looking for. The companies that get the most value are the ones that come looking for honest feedback. And so we help answer questions like, is this solving a priority healthcare challenge? Which organizations should you be talking to? What evidence will buyers actually care about? And how do you design a pilot that's meaningful? One of the biggest mistakes we see founders make is assuming they already know what buyers want. And getting early feedback from health systems, payers, providers, and community partners often changes not only the sales strategy, but sometimes even the product itself. And that's a good thing. It's much better to learn that during a pilot than after you've built your commercialization plan. And in closing, I'll say that our goal isn't simply to help companies pilot in New Mexico. Our goal is to help companies become stronger companies because they came through New Mexico. And so if you can demonstrate value in one of the country's most diverse, rural, tribal, and medically underserved states, you've built something that's much more likely to scale elsewhere. And that's the opportunity we're building here. We'd love to work with founders who are excited to build alongside our healthcare organizations, not just sell to them. Thank you. And with that, I'll hand it over to Stephanie.
Great. Thanks, Angelica, and big thanks to Builders VC for supporting all that HealthInno does since day one, and to you for having this vision. Hi, everybody. My name is Stephanie Garadia. I am the Health Innovation Advisor at HealthInno. I am also a population health researcher at the UNM Center for Health Policy, where we do policy analysis in support of our state Medicaid. This position gives me a really unique insight into what's happening across our state, where the gaps are, what the data says, and most importantly, and excitingly to me, where innovation can really push the envelope on how we deliver care across distance to different populations and communities, and ultimately how we transform the healthcare system. Next slide, please. Oh, we skipped one, but today I want to talk a little bit about HealthInno as the statewide health innovation hub, but more specifically, what you all came to hear about today is our flagship 2026 program, which is actually called Health Impact. And ACT is Advanced Computing Technology, and I'll talk a little bit about how that program works. Next slide, please. All right, so health impact helps healthcare organizations identify priority challenges, review vetted startup companies, and explore structured pilots. So as Angelica mentioned, the HealthInno network includes all of that work. We do a number of things. We have health technology training boot camps and all kinds of fun stuff. Health Impact is really the innovation program for this year, where we are trying to connect novel startup technologies to all our healthcare organizations who are interested in piloting new things that might solve old problems in new ways through these structured pilot opportunities, as Angelica mentioned. Next slide, please. So I want to talk a little bit about, at a high level, how this program works, what we look for in our startups, and then Joseph later will dive a little bit more into the technical details of the program. But generally, at a high level, what we're looking for is strong alignment with your solution to New Mexico's needs, challenges, and priorities, of which Ange elucidated very nicely. And something that fits a clear healthcare use case. And what I mean by that in our context is, certainly, we know that revenue cycle and things like that are healthcare use cases and needs, but we're actually sourcing from our community healthcare providers what are the real nitty-gritty challenges that they're having that's top of mind for them right now. And then we go out and try to find, as I mentioned, novel advanced computing technology or solutions that can help to solve those problems. So by doing that, we're also vetting the startups for, is there an operational and clinical workflow fit based on what the healthcare organization already put forth? So in essence, we're doing some of that upfront customer sourcing and pain point vetting for you. I mentioned the pilots. And so once we've identified a match, we are looking for types of solutions that can show value in a 1 to 3 month pilot. That can be a little bit of a tight timeline, but we really are looking for things that we could put in or pilot or drop in on a small scale basis, whether that's a small population or just with one provider out of a group or what it may be, that can start to show some early signals within 1 to 3 months on average. That's about the size of a pilot that we're looking for, as opposed to large enterprise grade replacements or EHR replacements, things like that. For this particular program, we're looking for things that do not have a current dependency on FDA approvals, regulation, or are waiting on any kind of clinical trials, just given the timeline and the horizon that we're looking for. And we're also looking for startups with a mature enough team who are able to engage our healthcare partners where they're at responsibly and effectively. Next slide, please. Great. So I alluded to this a bit, but the health impact categories, again, that's advanced computing technology. That is a priority that has been put forth by our state economic development department as a priority area for economic growth, which is why we are focused on bringing more of that into healthcare. So that can mean broadly things like AI-enabled digital health solutions or big data, complex data, care coordination platforms, quantum modeling and simulation, anything that really has a strong compute component or a digital technology type of a component is really what we're focused on, as opposed to, say, largely service-based models or care delivery service type models. So some examples or use cases of how that plays out. These are just some examples of many, but we are particularly interested in things that extend care across distance, as we're a highly rural state. We're looking for things that can not only enhance operations intelligence, but possibly optimize or, though I hate to say the term always like do more with less, but we're really looking for optimization or maximization of efficiency with our limited workforce and tools that can help us do that in a smart, predictive way. We're interested in population and data modeling. Down to the bottom left there, any kind of early diagnostic or predictive tools, algorithms, technologies that help us to identify health signals earlier, but more importantly, act on them earlier. Those are very interesting to us, whether those be edge technologies or even wearables or sensors, things like that. We're very interested, and we haven't seen too many of AR or VR, augmented reality or virtual reality, or other types of immersive training, support, or patient engagement tools, computer vision, things like that. and really any kind of next gen technology that helps healthcare leaders make better decisions. So again, these are some examples of many, but just so you can get an idea of what sorts of technologies we're looking for. As far as who our program serves, of course, we talked about our healthcare organizations, which are the crux, and of course, are the patients and communities that they serve, the crux of the program, who we aim to support. They're facing many different challenges that Angelica mentioned. And of course, we're also here to help startups and growth stage companies like yours to understand the New Mexico landscape, to figure out where you may fit, and to ultimately come together in the middle there to create a bridge so that we can bring these things together and again transform healthcare. Next slide, please. Thank you. So this kind of sums everything up, in one picture that I said, but we have our healthcare leaders and our startups here on the left. We're really interested in these scoped, time-bound, vetted, curated, high-quality pilot opportunities that we can help to facilitate and to help to make happen. And ultimately, our big, lofty, audacious vision is to improve healthcare delivery across the state and beyond. Next slide, please. All right. And with that, I will hand it over to Ms. Trevina Broussard, our Network Development and Engagement Lead here at HealthInno. Thank you.
Thank you. Thanks, Steph, for giving us kind of an idea of what health impact looks for and how best to work with us. For what I'd like to open up is how the New Mexico organizations, like what their pain points are. I'd like to explain that. So in my talk, we're really going to dive in a little bit more into what our organizations are looking for, how we've classified those pain points, and then I'm going to give us an opportunity to actually dive into some of the case studies, actual organization pain points that we're facing right now that you may be able to help with. So across the organizations that we work with, next slide, please, Joseph. Across the organizations that we work with, what we've noticed is that there are 4 priorities that keep surfacing. The first is patient access. This, when you think of it as a pain point, we're talking about the friction in scheduling appointments, the missed appointments that result from the constant back and forth from that friction, the broken referrals that create avoidable gaps in cares for a lot of our organizations. The second is workforce and administrative burden. So when we classify this pain point, we're looking at those provider shortages, the paperwork load that is a result of all of that often falls on our staff that can be quite a burden for them to dig out from under. And then third is our chronic and behavioral health component, especially the time and the wait in between visits, and those undersourced communities, under-resourced communities, some of which Angelica mentioned at the beginning, in how do we bridge the gap there for those instances where we're needing that behavioral health. And then fourth, the pain point is innovation funding and reimbursement, because we're noticing that our providers want to innovate. They have great ideas. They've identified pain points, but the payment systems have not kept up with these new models of care. So that's the statewide picture. Now, I'd really like to take an opportunity to dive into and show you 2 concrete examples, 2 real life examples of organizations that we're working with right now. We've taken the opportunity to anonymize everything we're sharing, but it'll give you an opportunity to see how distinctive their pain points are and how we're really trying to find some innovative solutions that we can bring to the table. So the first company, Company One, this is a large hospital system. So think an organization with many clinics, many providers, and a lot of, administrative machinery behind every patient visit. When we met with them, they named 3 priorities. The first is primary care access and scheduling. They were noticing that in their appointment times, which are about 15 minutes, and then patients would also wait months to be seen. That gap between how care is scheduled and what patients actually need is what they want to solve. That was the pain point they were bringing to us. They're looking for smarter scheduling, better pre-visit preparation for those clients, and ways to monitor those chronic patients that are at home. So whether it's maybe you have a solution for a wearable device or whatever type of innovation, how can they make sure to monitor their more chronic patients at home in between visits, so that not every need turns to an office visit. The second priority that they named for us is prior authorization. This was a step where the provider has to get the insurer's approval before they're able to deliver any type of care. Today, that system is done completely by hand. And so staff will make the phone calls. They're asked to translate insurance language into medical terms, one case at a time. So you can see how this can add to that administrative burden and strain that we just mentioned. What this company is wanting is automation that can read the payer's policy and convert it, almost like human in the loop, where their clinician isn't having to bear the burden of that and make all of the manual entries. So their people are doing less of that manual back and forth. And then the third pain point that this hospital gave us is the provider back and forth is causing a lot of burnout. This is creating repetitive nursing, billing, and coding work that is draining staff at every level. And what we found in New Mexico is there's often in these rural locations and even some of our metro locations, we're lacking the workforce. So one way that we can make that role sustainable and work with what we have is having a system that helps prevent some of that back and forth administrative burden. Ambient dictation was brought up as kind of a software that can listen in between visits and writes those clinical notes automatically, so they can already have that installed, and that takes some of the burden off. They were not asking necessarily for how the automation would work, but they were more asking for what that piece would look like in solving that pain point. And then our next example that I wanted to show is Company 2. This is a little bit different of a system. The second is a community health center. So this is a network of clinics serving a largely rural, multilingual Medicaid population, which means access to language is part of their daily reality in providing care for that community. And so the name priorities for this community health center, the first was that they were interested in patient routing and no-show reduction. They were looking for a solution that could help them, similar to the first one, but help them bridge the gap in that. The next was that they were looking for language interpretation. As I mentioned, this is a multilingual community, and often that Spanish to English, English to Spanish is part of their daily reality, and they're wanting a cleaner way to manage and track those referral between specialists, and to close the gaps for those, under those value-based contracts that they're holding. And then the administrative burden, like I mentioned, they were talking a lot about how just refills and getting authorization like that was really kind of clogging their administrative system and their administrative workflow. And that clinical decision support, having something that can be like an AI that could always give them a little bit of a clinician in the loop opportunity. And what I want to flag about both of these companies that we're presenting is what we're noticing as we're working through them is the company's priorities are very, very precise. They're not just we're looking for AI or we're even looking for a human in the loop. It's to provide a very distinct type of return. And it's not necessarily a wish list of innovation in general, but the buyers are telling us exactly where the pain point is and how we can reduce that, like what would be a measurable reduction of that. So, yep, next slide. Thank you. So before I give you an opportunity to pass it on, what I'd really like is an opportunity for us to discuss what challenges you may face when you're approaching New Mexico. You're welcome to put it in the chat and use that as a space. Some of the things that we often see is how difficult it is in the process and understanding whether you have the right person. But once you map the name priority, which we've done a really great job of doing with our healthcare organizations, not just in a broad category, but in a very distinctive way to solve that pain point, we're able to really make the connections and really drive home on where these solutions that you may be providing from your startup, how that can land. And then second, we're really looking for how that measurable outcome can result for these healthcare organizations. How does that measurable outcome result for the communities that they serve? And then third, we're also looking for, how can we show that value once it's deployed in a 1 to 3 month window? So as you're thinking through how you may help, whether it's company one or company two, through some of the pain points that they've mentioned, what can make it really great is understanding exactly how your solution supports their pain points now based on those very distinct pain points that they provide. So, like I said, let us know some of your challenges before I pass it over to you, Joseph. I see you getting ready. Let us know some of your challenges. What are you finding as barriers for you kind of landing and finding a place for your solutions in New Mexico? And I'll watch the chat. Joseph, I'll go ahead and pass it to you.
All right. Thank you, Trevina. Very, very helpful. Um, yeah, these are actual two companies that we're working with to help solve their priorities and with some solutions. So hopefully one of you or many of you can help address those solutions. And so we do encourage you to apply for our program. So I'm going to talk about what we do in the back end when we get startups that want to participate in our program. So I'm Joseph Sapien, Program Director for HealthInno. And how to join the Health Impact Program. This was a program that was funded through the state of New Mexico, and really it's meant to make that match that Stephanie was talking about earlier. When you have the priorities that companies are sharing with us, we do our diligence on looking and finding out where the innovation and most viable solutions are to get a pilot. So, how it works is organizations define their priorities. As Trevina mentioned earlier, those are very specific priorities or pain points that were shared with us, and so we're laser focused on what we're trying to find a match to address those solutions. So, what HealthInno does is we identify solutions, some through our internal pipeline. So the application process that we have on our website, you can go ahead and fill out those, and then our system, and we'll look at those to find whether your solutions are matches. So what we then do is match those startups and present to participating organizations. So organizations that we're working with, like the two that Trevina had mentioned, we then would go back to them in our advisory council to basically see if there's a true match. And yeah, I mean, really, that's where the magic happens. Is now we're starting to see, okay, let's go ahead and create this match, and then we move into our participants opt into host pilots, and that's where now we're going to draft MOUs, more contractual obligations and commitments to execute on these pilots, which then will be evaluated for to see if there's positive outcomes. HealthInno will provide some technical assistance to make sure that this facilitation and this journey is executed, because what we want is successful pilot outcomes that will hopefully transform healthcare for the state of New Mexico using your all's technologies. So what we ask for is, you'll notice on our application form some critical items that we collect, and this helps us be able to make sure that we're doing our best to find the matches for those priorities or pain points. So we ask typical questions like company contact information, What's your solution about? What is it actually solving? What type of technology is your solution or your innovation? What does it use as far as technology? And so, Stephanie talked about advanced computing technology. Like, where does that fit in into your model? Is there a fit for New Mexico? I think that's where we come in as well, is vetting some of the priorities that come in. We meet with the healthcare organizations to really refine their priorities. If they give us a broad brushstroke, when Trevina was presenting her first few slides, her first slide was kind of those are the broad brushstrokes, and we can kind of see some patterns that are happening. And then we refine with the companies on specifically what their priorities are. So, does your company have traction and funding? Um, we want to work with startups that want to do business in New Mexico and solve priorities. But if you're too small, as far as, you're still in a concept, maybe you have a solution that hasn't been tested in the environment. We're looking for a little bit more mature startups that have some traction, have raised around, because we're putting you in front of some large companies, where we don't want to set you up for failure as well. So, we ask for what kind of traction and funding have you received. We also look for buyer and ROI. Do you have any examples, case studies, documentation that show buyers that you've worked with, revenue, and what were the ROIs from that? Just so we can also make sure when we present to your all solutions to some of our organizations, we have that checked off. So what else we look for is pilot readiness. That's the goal that we want to get to. So have you all launched any pilots, right? And so we want to capture that in our application form so that we know like you have that lingo, that expectation that working with healthcare orgs, you've already kind of gone down that path. We also look for integration and rollout. So, all right, it's go time. Are you able to have that execution ability to, pursue and roll out your technology within the healthcare system? Security. We do ask for what type of technology and SOC compliant. We do, as you know, working in this space, security and privacy is at the top of the vetting process. So if you're not able to speak to that or share that information, we'll be able to see that in our form. Regulatory status, have you been FDA approved? Talk to us about that in our application form as well. So we cover some questions there. And then your pitch deck and IP, we do keep your information confidential. So we would ask that you share that as well. So I'm going to cover a little bit more on good to know in the next slide. So who's a fit and not a fit? Okay, if you're a good fit, you're pilot ready. Okay, you've maybe launched some pilots already. You have one pilot under your belt or multiple. You're building something that can be deployed and show value within 1 to 3 months. Now, that could be also thinking about, okay, well, onboarding and things like that. So 1 to 3 months is what we're trying to get to. If it's 3 to 6 months, we understand the onboarding and all of the training and things like that, depending on the scale of that pilot. So if you're 1 to 3 months, that's great. If it's 3 to 6 months, we can do that as well. Okay. Are you able to run a structured time-bound evaluation? That's really the key is how are you capturing the value in a short amount of time so that there can be an assessment and say, okay, yeah, like the company is happy with the results, and now we want to pursue a bigger scale from that pilot. And that leads us into that transformation work that we're doing at the state. And then are you ready to work in real clinical operations, not just demos? That's critical. I'll stress that that's very critical. So that's where kind of our form kind of helps us to identify if you're too early or too green. This is why it's important. And then open to learning, no guaranteeing sales or procurement. I think this is critical. I think when you're a startup as well, that feedback, yes, you got a pilot successful. Did it show positive outcomes or not? But you were able to go through a process that ultimately was for the betterment of healthcare. Who's not a fit? If you're building FDA regulated device that is not yet, or diagnostic and therapeutic that is not yet cleared. We stress that just because of the time frame and the uncertainty that that may take. So we're not really looking for that with our year grant that we have with the state and the expectation to deliver this in a short amount of time. So currently pursuing FDA, we're not too excited. Now you can be both. You can have something currently pursuing, but maybe you already have a product or an earlier version that is working and functional. So there's a little bit of gray there, but you'd have to show some proof there. Department, depending on clinical trials, yeah, again, stressing that we just don't have the time to wait on those clinical trials. So maybe down the road in the future. And then are you pre-product or concept only? Definitely you're not ready to pilot, so we wouldn't engage or entertain wasting anybody's time. And then looking for guaranteeing customers fast. Like sometimes these things take some time. So it's really the relationship that you're building with us and the healthcare orgs that we're most interested in. So how we evaluate, we look at category depth and focus. So a lot of our evaluation based on your applications and your submissions, and then our matching with the healthcare orgs. We look at 9 things: category depth and focus, problem and urgency. Is it really solving a problem? Is it an urgent problem? Um, Buyer clarity. Does your technology have a very clear buyer, value prop? Pilot deployability. Again, can your technology be deployed? Very simple there. So we'll do some analysis there. Workflow fit. Does it fit the right size of the client that we're working with? And then measurable outcomes. Is your technology and your innovation really been able to measure outcomes? And it's not just something that's theoretical. Security and compliance, again, we stress this. It's a high weighted category here that we evaluate is security and compliance. It's super important to our clients that we do our diligence on that area as well. So evidence and traction, I talked about that earlier and why that's important. We don't want to put you in front of a company that we want to make sure that you have some ability to execute. And then team credibility, are you a small team? Are you a large team? What kind of advisors do you have on your team? How long have you guys been working for together? Things like that. So those are how we evaluate um, the startups. In closing, we're building New Mexico statewide health tech network marketplace. This is what we're doing. We've had over 40 startups that have applied into our pipeline, and so we constantly are evaluating those internal pipeline. We're talking to healthcare professionals to find matches. And so if you want to be in our network, we encourage you to apply in our network. While we may not have a client for you at this particular moment, if we do not, you're in our system so that if there's a match in the future, our system will be able to detect whether your technology is solving someone's priorities. So lastly, just we encourage you to join our program. There's no cost to it. It just takes some time to fill out our application. And then those companies that Trevina talked about, those are real examples of companies that we're actively working with right now. So if you did see that there was a match or some similarity or some connection to your technology and to those, I'd highly encourage you to fill out our application. So um, yeah, we'll close up with questions, and then we do have our big Health AI Summit in the near future. It's on October 8th in Albuquerque. We'll have healthcare professionals there, startups, a lot of policymakers. It's just a great celebration and action for New Mexico. So I'll stop there and open it up for questions and any comments. Angelica, Stephanie, Trevina.
No, I would just reemphasize that the application is ongoing. So even if you aren't matched with the healthcare organization immediately, we are the the option for healthcare orgs to participate is also ongoing. And so we continue to bring on new host organizations who are interested in participating. And so at that point, we collect their priorities. And so there's always a potential for a match in the future if it isn't immediate.
Any questions from the audience? I think we have, let me open up the chat real quick. Please share deadline again. So the deadline it's a rolling, there is no deadline as priorities come in, but we do, the sooner the better. So if you can fill it out, again, we'll run it through our system to find matches, but I would say the sooner the better that you can fill out the application. So thank you. There's a question on what's the funding for pilots?
So pilots don't receive any funding. In the future, we're looking at expanding that with more of a focus on the provider side, especially in our rural populations, where we recognize that providers need new tech, but they don't necessarily have the dollars or the resources to devote to testing and adopting new solutions. And I think, Joseph, do we have the application link handy that we could just drop in the chat here as well for folks who are interested in applying?
I'll drop it in. Give me a few seconds and I'll drop it in.
And so we do leave contract negotiations entirely up to startup and healthcare organization. We make our recommendation of standard terms that should be considered as the MOU drafting begins. But ideally, in the perfect world, should the pilot be successful, then the healthcare organization is going to want to move forward into purchasing. And so then that would move into contracting, and that would be entirely between startup and healthcare organization.
Okay, we have another question. Should we have partner clinics, health systems to apply, or can HealthInno team match us to who could be interested based on the application once selected?
Let's see, Catherine, are you referring to partners that you have in other states, or can you provide a little bit more clarity on that?
No, I'm just curious about should we have a partner in New Mexico already, or
Oh, no.
who will help us to navigate?
Yeah, I mean,
Based on their need.
so most of the startups who have applied are interested in doing business in New Mexico, but have not yet made that entry point. And so this is part of the process of us helping to facilitate that based on the pain points that our healthcare orgs in the state have already expressed.
Yeah.
So you don't have
We don't need to find a partner to apply, right?
nope.
Okay.
No,
Yeah.
if you have a solution that particularly addresses some of the pain points that we went over in this presentation that we're actively sourcing for, then startup just needs to apply. You're in our pipeline. There's no requirement that you bring a clinic or a provider to the table for application.
Oh, yeah. Thank you. That helps a lot. Yeah. Thank you for the great opportunity.
Yeah. And yes, we can share the recording. Absolutely.
Any more questions? All right. I think there's no more questions. Ange and Steph, Trina, do you want to wrap?
Yeah, I think we're good to give folks a little bit of time back. Appreciate you all joining us around the lunch hour. And we do hope to see some of your companies come through the pipeline. So excited to see next steps.